Good afternoon, everybody. I'm going to talk about mental health awareness. To start with, I'll give the definition of the mental health, then I'll describe the causes of the mental health problems. After that, I'll mention early sign of mental illness. Later on, I'll give mental illness handling. Finally, I'll summarize my presentation. I'll try to answer any of your question after the presentation. Let's begin by what is mental health. According to World Health Organization WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively, and is able to make a contribution to his or her community. Mental health is the foundation of emotion, thinking, communication, learning, resilience, and self-esteem. Mental health is also key to relationship, personal and emotional well-being, and contributing to community or society. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, for, from, the, from childhood and adolescence to adult. The, the WHO stressed that mental health is more than just the absence of mental disorder or disabilities. Mental disorder or mental illness is health condition involving changes in emotion, thinking, or behavior, or the combination of these. Well, I've told you about what is mental illness. Now, we'll move on to why people can have mental illness. Many factors contribute to mental illness, like biological factor, life experience, and continuous social pressure. Biological factors such as genes, like if your parents have a bipolar, you more likely develop bipolar by yourself. Life experience means you have trauma from the past, losing family or someone close, childhood abuse, accident, or rape victim. Continuous social pressure like loneliness, bullying, or social disadvantage. We'll look at causes of the mental illness. Then, we'll move on to early warning signs of mental health problems. First, eating and sleeping too much or too little, then having low or no energy, displaying negative emotion, having unexplained aches and pains, feeling helpless and hopeless, feeling unusually confused, forgetful, angry, worried, and scared, having persistent thoughts and memory you can't get out of your head, being unable to complete daily tasks, hearing voice or believing things that are not true, and thinking of harming yourself or others. I've told you about warning signs of mental health problems. Let me turn now to type of mental illness. There are many types of mental illness such as anxiety disorder, bipolar disorder, depression, OCD, personality disorder, PTSD, and many others. Anxiety disorder differs to normal feeling of nervousness and anxiousness and involve excessive fear or anxiety. Bipolar disorder is a brain disorder that causes changes in a person's mood, energy, and ability to function. People with bipolar disorder experience intense emotional states that typically occur during distinct periods of days to weeks, called mood episodes. Depression. Major depressive disorder is a common and a serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it's also treatable. Depression causes feeling of sadness and or a loss of interest in activities once enjoyed. Obsessive compulsive disorder, or we know as OCD, is a disorder in which people have recurring unwanted thoughts, ideas, or obsession that make them feel driven to do something repetitively or compulsion. Personality disorder. A personality disorder is a way of thinking, feeling, and behaving that deviate from the expectation of the culture, causes distress of problem functioning, and lasts over time. Types of personality disorder such as antisocial personality disorder, avoidant personality disorder, borderline personality disorder or BPD, dependent personality disorder or DPD, PTSD, post-traumatic stress syndrome, is a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event such as a natural disaster, a serious accident, a terrorist act, war or combat, or rape, or who have been threatened with death, sexual violence, and serious injuries. We've looked at many types of mental health problems. Last, we move on to mental health handling. After you know the sign, what should you do next? Go treatment. Mental illness is treatable. The vast of individuals with mental illness continue to function in their daily lives. There are various methods for managing mental health problems. Treatment is highly individual, and what works in one person may not work for others. The treatment can include psychotherapy or talking therapies. This type of treatment takes a psychological approach to treating mental illness. Psychiatrists, psychologists, psychotherapists, or some primary care physicians carry out this type of treatment. It can help people understand the root of their mental illness and start to work on more helpful thought patterns that support everyday living and reduce the risk of isolation and self-harm. Medication. Some people take prescribed medications such as antidepressants, antipsychotic, and anxiolytic drugs. Although these can cure mental disorder, some medication can improve symptoms and help a person resume social interaction and a normal routine while they work on their mental health. Self-help. A person coping with mental health difficulties will usually need to make changes to their lifestyle to facilitate wellness. Such Changes might include reducing alcohol intake, sleeping more, and eating a balanced nutrition diet. People may need to take time away for work and resolve issues to personal relationship that may be causing damage to their mental health. This is what you can do if you know someone at immediate risk of self-harm, suicide, or hurting another person. First, ask the thought question like, are you considering suicide? Then listen the person without judgment. After that, call 911 or the local emergency number or text talk to 741 to communicate with a trained crisis counselor. After that, stay with the person until professional help arrives. The last one is try to remove any weapon, medication, or other potential harmful object. That's all I have to say about mental health awareness. In conclusion, mental illness is nothing to be ashamed of. It's like a medical problem, just like heart disease and diabetes. People who living with mental illness are same like others, but kinda special. Don't ever judge people just because they have mental illness, cause they don't want to. Be friendly with them, stay with them, tell them positive thing, not toxic positivity. Listen what they say, give support, and never compare themselves with others or even you, cause they don't need to. Thank you for all being attentive audience. The Eradication